All right, welcome to The Explainer. Today, we're diving into something that could change how you think about high blood pressure forever. You know, for decades, we've pretty much treated it as this one single thing. But what if I told you that for millions, and I mean millions, of people, the real cause is something totally different? Something that's been hiding in plain sight all this time.
So let me ask you this directly. If you have high blood pressure or you know someone who does, do you really know what's behind it? I mean, the usual story we hear is that it's primary hypertension, which is basically a fancy way of saying we don't know the exact cause. But what if that's not the whole picture? What if there's a secret your high blood pressure is hiding? Okay, so here's the bombshell. The truth is, a massive number of people are out there getting treated for just, regular high blood pressure. But in reality, they have a very specific hormonal problem. And get this, it's not only treatable, it's often curable. And because it's being missed, they aren't getting the right treatment. And worse, they're facing much, much higher health risks. So you're probably wondering, just how common is this? Well, buckle up because the latest research is pretty mind-blowing. It suggests that as many as 1 in 7 people with hypertension, that's 14%, might not have normal high blood pressure at all. Instead, they have this thing called primary aldosteronism, or PA for short. Think about that. 1 in 7. That is a staggering number of people walking around with a completely misdiagnosis. All right, so what in the world is primary aldosteronism? Let's break it down. The easiest way to think about it is like this. Your body has a hormone that acts like a salt magnet. And in PA, that magnet is basically stuck on overdrive.
Okay, so for the more technical definition, you've got these two little glands called adrenal glands, right? They sit right on top of your kidneys. Well, in PA, one or both of them just goes rogue and starts pumping out way too much of a hormone called aldosterone. Now, aldosterone's main gig is to handle your body's salt and water levels. So when there's too much of it, your body grabs onto salt like crazy. And wherever salt goes, water follows. All that extra fluid floating around your blood vessels, that's what sends your blood pressure sky high.
And listen, this is probably the most important thing to understand. PMA is not just another name for the same old problem. It's a completely different beast. The high blood pressure you get from this hormonal issue is way, way more dangerous than regular hypertension. And this is true even if the blood pressure readings are identical. Just how high are the stakes? Well, a huge study looked at all the data and found some pretty scary stuff. If you have PA compared to someone with standard high blood pressure, your odds of a stroke are 2.6 times higher. Your odds of developing AFib, that's an irregular heartbeat, are 3.5 times higher. And your odds of heart failure? They're doubled. We're not talking about small percentages here. This is a massive leap in risk, and it's exactly why we have to find out who has it.
Okay, so the obvious question is, if this is so common and so dangerous, why are we missing it all the time? Well, for a long time, the testing was just a hassle. It was complicated, kind of a pain, so doctors only did it for the most extreme cases. But that is all about to change. There's a whole new playbook.
And this right here, this single sentence from a new 2025 clinical guideline is an absolute game changer. It says we should be screening every single person with hypertension for PA. Not just the weird cases, not just the hard-to-treat ones, everyone. This takes PA from being this rare thing only specialists worried about to something that should be a routine check for millions of people. So how does it work? The path to a diagnosis is actually pretty straightforward now. It all starts with a simple blood test. They just check the levels of 2 hormones, aldosterone and renin, and look at the ratio between them. If that ratio looks suspicious, you might need a follow-up test to be sure. And the final step? A scan, like a CT scan, to pinpoint the source of the problem. Is it just one adrenal gland misbehaving, or is it both of them? Okay, but what about your meds? This is the big question, the one that honestly stopped this from happening for years. The old way of doing things meant you had to stop all your blood pressure medications for weeks before the test. And you can imagine, that's not just a pain, it can be downright risky. It was a huge roadblock for sure. But here's the great news. The new guidelines tackle this problem head on. They've come up with much smarter, more practical ways to do it. For a lot of people, you can get screened without stopping your meds at all. And for others, you might just have to pause 1 or 2 specific drugs for a short time. This makes testing so much easier and more accessible for pretty much everyone.
And this, to me, is the most exciting part of the whole story. Once you know you have PA, it opens up a whole new world of treatments. We're not just talking about the usual blood pressure pills anymore. We're talking about treatments that go right to the source and fix the actual hormonal problem.
Basically, there are 2 paths forward. If both of your adrenal glands are causing the trouble, then the fix is medication. You take specific pills for life that block the effects of all that extra aldosterone. But, and this is the really incredible part, if the problem is only coming from one gland, a simple, one-time laparoscopic surgery to remove that gland can be a cure. A literal, honest-to-goodness cure for your high blood pressure. Just let that sink in for a second. So for the people who do need the medication route, the great thing is that it's a targeted attack. Instead of just using a blunt instrument to lower blood pressure, these drugs are like smart bombs. They go in and specifically block what that nasty excess aldosterone is doing in your body.
The 2 go-to medications here are called spironolactone and eplerenone. Think of it like this. Spironolactone is the classic choice. It's super effective, it's cheap, but it can have some side effects for some people. Then you have eplerenone. It's newer, more targeted, so it has fewer side effects, but it's also more expensive. The cool thing is this gives you and your doctor options to figure out what makes the most sense for you.
All right, let's bring this all home. What does this actually mean for you? If you're sitting there with a high blood pressure diagnosis, how can you put this information to use?
Get ready for a really shocking number. There was a huge study. We're talking over 250,000 veterans, all of them high risk with stubborn high blood pressure. Guess what percentage of them were ever actually tested for PA? 1.6%. Just 1.6%. The gap between who probably has this and who gets tested for it is absolutely massive. And why does that giant gap exist? It's simple. Awareness, or a lack of it. For years, the guidance was confusing. The testing was a pain. But now, with these new clear guidelines and easier testing, the biggest thing standing in the way is just not knowing. Not knowing to even ask the question. Okay, so let's boil it all down. Here's what you need to remember. Number 1, your high blood pressure might have a hidden hormonal cause. Number 2, a simple blood test is now suggested for everyone with hypertension. 3, finding out you have PA can unlock better treatments, and number 4, for some lucky people, it can even lead to a complete cure. Which brings us to the single most important takeaway from all of this. Go to your doctor and ask one simple, powerful question. Hey, should I be screened for primary aldosteronism? You know, this whole thing really makes you think, doesn't it? Here we have one of the most common medical conditions on the planet, and a huge piece of the puzzle was just hiding in plain sight. It's such a powerful reminder that what we know in science is always changing, always evolving. It just makes you wonder, what other common conditions that we think we've got all figured out are just one breakthrough away from changing everything?